Medical professionals are setting the record straight when it comes to the COVID-19 vaccine. Joining us now is Dr. Stacy Valander with Stanford Healthcare. Good to see you. So first of all, what kind of side effects could we experience after receiving the vaccine?
Good morning, thank you. So speaking specifically about the two leading vaccines, Pfizer and Moderna, they both have very favorable safety profiles and actually similar side effects across the two. Each of these trials had tens of thousands of volunteer participants of diverse races, ethnicities, genders, some of whom also had chronic medical conditions. So not only are we grateful to these volunteers for truly being the very first in line to get the vaccine, but we also now have a fairly good understanding of how humans react to these vaccines. So the most common side effect is soreness at the site of injection. This is typical for vaccines, as many of us probably have experienced at one time or another in the past. The next most common set of side effects are, at least based on the clinical trial, were fatigue, headache, and body aches. And even less common were joint pain, chills, and fever. And these all typically resolve on their own within a few days.
Another article claims the vaccine could cause Bell's palsy. Is that true?
So a brief description, Bell's palsy is a temporary paralysis of part of the face, and temporary being the key word there. So there have not been any confirmed accounts of Bell's palsy caused by the virus. And the cause of Bell's palsy in general is unknown. So where this is coming from is in the Pfizer trial, there were actually reports that 4 out of more than 40,000 participants had experienced Bell's palsy, and those were in the vaccine group. So under normal circumstances, about 3 in every 10,000 people experience Bell's palsy just spontaneously as a part, of life. And so, in other words, this could have been pure coincidence that the trial participants experienced Bell's palsy, during this trial. Similar rates have been also noted with the Moderna vaccine. So it's something that they're going to watch very closely as the vaccine rolls out. And another side effect I'll mention that you might have read about, and this is for the Pfizer vaccine specifically, was an allergy-like reaction in 2 to 3 patients in the vaccine group. Now, those reactions only occurred in individuals who already needed to carry an EpiPen. That's the medicine that stops a severe allergic reaction. And so those were, people with probably some sort of predisposition, but that link is also not fully understood. So for that reason, for the Pfizer vaccine, they're actually recommending that every person who's vaccinated remain in place for at least 15 minutes prior to the vaccination. And that's just to observe for any allergic reactions. If that does take place, and remember, this was very, very rare, a medical professional can be standing by to address it.
What about, there was an article on social media talking about it could alter your DNA. Is there any truth to that?
This is absolutely untrue. The COVID vaccine, and I'm talking specifically about the Pfizer Moderna, it's carrying a genetic material called messenger RNA. Just like the name suggests, this sends a message to our protein-making factories in the cytoplasm of the cell to instruct them to make the spike protein on the outside of the virus. So it's not making the whole virus, it's just making the spike protein on the outside. So the immune system sees that little snippet, that protein, and it mounts an immune response to it, which can cause those side effects that I mentioned. So all of that activity happens in the cytoplasm of the cell. That's where the messenger RNA goes. That's the fluid part towards the outer part of the cell. Our human genetic material, the core of it is the DNA, which is stored inside the nucleus in the very center of the cell. And so the messenger RNA never goes there. It's not designed to go to that part of the cell. So it's a new vaccine. The science is a little bit tricky, but there's no way the RNA can change our foundational DNA.
Another myth out there is that the vaccine could actually cause you to get COVID-19, but you say that's not true either.
Correct. That's not true. So as I explained, the messenger RNA creates just that snippet of the viral material. So it's not the whole genetic code of the SARS-CoV-2 virus that causes COVID-19. It's just the snippet of it. It's enough information so that our immune system learns about it, learns to recognize it, to mount an immune response. but it's not enough to make us sick with COVID-19. And remember, the whole point is that the immune system remembers that little spike protein, so that later when you are presented with SARS-CoV-2, if it does enter your body, then the immune system can mount that rapid response to prevent illness.
Okay, Dr. Stacy Valander with Stanford Healthcare, thank you.
Thank you so much.